Hello, my friends, and those of you who aren't my friends who just passing by. Listen, I got something to say about the Veterans Administration. Its health care sucks. I've been a disabled veteran since 1973, and health care with the VA has been pretty good. Didn't have any complaints till 2010. In 2010, they did a hip replacement and they screwed it up and left me with chronic pain that has never stopped in 15 years. It's never stopped. I've suffered with this pain in my hip for 15 years. And I've been to VA pain specialists, I've been to Medicare's pain specialists, and I've been told that there's nothing more that can be done, that I'm going to live with this pain until I die. It'll stop when I stop. I've learned to live with it. I've accepted it. It's made my life. It's cut out a lot of what I could do. A lot of what I wanted to do, I can't do now because of my mobility problem. And then recently, I've seen the VA for various different reasons since then, but recently I've got to tell you how the VA healthcare sucks now. In early September, I had pain in my right shoulder, and I went to the VA. They did an x-ray and they said I had tears in my rotator cuff, and they wanted to do surgery. So about the second week of September, I was doing fine. I wasn't sick or anything. I just had this surgery need to be done on my shoulder. So they did the surgery on my shoulder, and they said I had a bacterial infection in my shoulder and they had to clean it out. And they put me in the hospital for 5 days, and they're giving me antibiotics. So from Monday till Friday, I was an inpatient in the VA hospital. And it was the worst time I've ever spent in a hospital, in any hospital. The worst, in my whole life, is the worst experience I ever had. I developed a stomach ulcer. I had constipation. I didn't have a bowel movement for 8 days. BM, my parents used to call it. Everybody was trying to stick needles in my arm to get blood for this, get blood for that. The food they brought, I couldn't eat. The coffee cups that they brought, I'll see if I can include a picture of that. They looked like they never went through the dishwasher. They came dirty. And they wouldn't let me, I was on the 4th floor, they wouldn't let me leave the 4th floor to go outside and just get some sun, to breathe some lungs of fresh air instead of hospital air. I was restricted to the 4th floor. I felt like I was getting antsy, almost claustrophobic. And so on a Friday afternoon, I said, I'm leaving this hospital with or without doctor's permission. And I signed paperwork to leave. They tried to convince me to stay, and I said, no, I'm not staying. So I got home at 4 o'clock on a Friday. A friend of mine took me home, gave me a ride home. Saturday and Sunday, now get this, on those 2 days, Saturday and Sunday, I had 9 BMs, 9 bowel movements in those 2 days. I was so sick. I was so drained. It took everything out of my body. I spent the whole 2 days and Saturday night in bed and only got out to go to the bathroom. Luckily, I have a neighbor who had a key to my apartment, and she came in and she would take care of my cats, like feed them and clean their litter boxes and do dishes, and she would give me chicken noodle soup, which is about the only thing I could eat. Never been that sick in my whole life. And then come Monday morning, I started to get my appetite back. But I was still very weak. I was really weak. I was weak for probably 2 weeks after that. And I had pain in this right shoulder that remained. So I'd been back to the VA. They said I had this bacterial infection had spread through my bloodstream, through my whole body. I now have a UTI. I've had a UTI for about a couple of weeks now. I had an appointment with infectious disease control at the hospital. I went there and I told them about it. They sent me some antibiotics, which I was taking till they're all gone, and then they sent me some antibiotics for 5 days. That's it, just 5 days. That's it. No refills remain. I still have the UTI. I'm out of the antibiotics. And I went back to orthopedics last week, and I told the orthopedic surgeon about this pain in my shoulder. It hurts so badly. I had the surgery about 2 months ago, and into the beginning of the 3rd month, and I still had this pain in my shoulder. It's never gone away. It's been a constant pain for going on 3 months now. And I told the doctor, he said, well, you need to take some Tylenol and this and that and the other thing. I said, I've tried everything over the counter. I've tried Tylenol, I've tried Aleve, I've tried everything over the counter. I said, you know what, I have 2 neighbors that were never in the military, and they get better pain management than I get. My immediate next door neighbor was never in the military. He complains of back problems, and he, through Medicare, he gets some morphine pills. The neighbor that took care of me when I was sick, she has knee problems, and her doctor gives her codeine and Tylenol. And so I'm not getting anything from the VA. So I asked this friend, I said, could I try a couple of your codeine and Tylenol? She said, yes, you're fine. So she gave me some codeine and Tylenol, and I took it. I don't know what the milligrams were. And in about 20 minutes, I could feel this pain go from a sharp pain to a dull ache. Excuse me, go to my eye. I can deal with the dull ache. It's that sharp pain I can't deal with. Physical therapy would come to my apartment 2 days a week and worked to get me full motion on my arm. Now I have full motion. I don't have a problem with the motion, but I have a problem with the pain. Here it is, the 16th of November, and I still have this sharp pain. It hangs around about a 6 on a scale of 1 to 10. It's about a 6. If I use it the wrong way, if I turn something, it'll go up to a 7, and that, oh man, 7 and pushing an 8. Man, it hurts so much. It's even limited more what I can do. The hip pain, which is I'm able to manage, has prevented me from doing a lot of things I want to do. Like there's no such thing as hiking. I can't walk very far. The VA gave me, some years ago, they gave me a power chair, but I can't be doing any hiking or walking. I can't go to a park and just walk around. It's just the hip won't let me go do that much. So now I've got this pain in my right shoulder, very severe pain, and I told the orthopedic surgeon about that, man. And I told him about me taking codeine and Tylenol. I said, I'm not coming here asking for drugs to get me high, get me buzzed or anything. I just need a prescription for something not that serious, but something like codeine and Tylenol that could take this pain and change it from a sharp pain to a dull ache. Just to bring it down a little bit. He refused to do that. He sent me lidocaine patches. a box of lidocaine patches. That's epidermal problems. That's for epidermal. This problem is not epidermal. This problem is either a ligament or ligament or what do you call it anyway? It's in the muscle. It's right. It's right here. Right here is where it hurts. Look. Right here is where the pain hurts. And it hurts all the time. It hurts now. It never stops hurting. For going on 2 months now. I'm going to start in the 3rd month. It's still there. It's never stopped. I could have had the same effect if he had sent me a roll of Scotch tape. You know, the VA is so paranoid about prescribing pain medication because of this opioid crisis a few years ago. They're letting a veteran suffer with severe pain. I'm talking about severe pain because they refuse to write a prescription for pain medication. I can't get it from the VA. They won't give me pain medication anymore. They tell me, they sent me the same thing as like a roll of Scotch tape, these epidermal patches, the lidocaine patches. They don't do any good. There's just total. I put a whole patch on here and left it on there for 12 hours. It did nothing. I could have put Scotch tape on there and had the same effect. So I'm going to have to go to Medicare and see if I can get Medicare to prescribe something for the pain. And the UTI, the urinary tract infection, I still have it. I have no more antibiotics for that. Now I have to go to Medicare and see if I can't get antibiotics for that. That's going to take a few days because they're going to want a urine sample. They're going to want to check it, and maybe a couple of days before I get it. So the infection is going to keep on getting stronger, and all the medication I took before might have been killing the bacteria, but now, since I don't have any more bacteria, it's free to grow and prosper, you know. And what I'm getting from the VA now is shit medical care. Just shit medical care. It's not worth a damn. Here I am, a disabled veteran, suffering pain that resulted from the surgery, and I still have it. I've had it for 2 months, and they refuse to do anything to help me. They're telling me over the counter, and I told them over the counter doesn't work. I've tried everything. The pain doesn't go away. And oh, see right now, if I try to move my arm, I can get it up there, and I can move it around and so forth. But oh Jesus, but the pain, the really sharp pain, that's good 7, good solid 7, maybe pushing an 8. And it never gets below a 6. It's there all the time. When I sleep at night, I have to sleep like this. This is the only way I can sleep. I'll sleep on my back, and I have my arm up here like this, because if I try to put my arm out, it hurts. So I sleep like this. I've got this pain all the time. It never stops. And the VA, I will never be a patient, an inpatient in the VA hospital again. If I ever have to go to the hospital again, it'll be University or Baptist or Methodist, but it'll never be a VA hospital again. I will not ever let the VA try to take care of me again. And one of the problems I had when I was in hospital was they hire nurses from Nigeria and Jamaica and God knows where else. So, and not being racist, I'm just telling you, it doesn't matter what color you are, but they come, they talk to me, and they have a heavy accent, and most of the time I couldn't understand what the hell they were saying. And they're wearing masks, you know, and they're trying to talk through these masks, and they had to take the mask down and speak slowly so I could understand what the hell they were saying. You know, they speak English, but with such an accent, it's difficult to understand what they're saying. So they're hiring these people from foreign countries to get cheap labor, you know, to try to spend as little money as possible. The other thing is, every time they hooked up that machine, you know, there's the oximeter, it always started out at 88. Every machine they hooked me up to started out at 88 for my oxygen level. They were saying, oh, you need oxygen. No, you know, you got COPD, yada, 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 yada. But I have an oximeter at home, and the physical therapist had an oximeter, and I always get 92, 94. And they sent me to what's called community care, to a place that does pulmonary testing. And I went and had a very comprehensive pulmonary test. And they walked me up and down the hallway, back and forth 6 times. And every time we got to the end of the hallway, they would check my oximeter again. It was 92, 94. One time was even 96. So how come every machine that the VA has started me out at 88, and they're saying, oh, well, you have trouble getting a 90 and so forth. But they're the only ones. Everybody else says I'm fine. The doctor at the pulmonary testing place said that I had a mild, very mild case of COPD, but I didn't need oxygen. But the VA said I did, because their machines all start at 88. And I'm wondering if their machines are set that way for a reason. Maybe they're reporting to the government, oh, look how the veterans have COPD, and we need more funding to help service these vets. You know, it might be a conspiracy. I don't know. You know, who knows what's going on. But 88, all the time, 88. That's where they started. And everybody else, 92, 94, even 96. So, excuse me for saying this, but I think the machines are bullshit. And I'm just not. I've still got this pain. I got this pain right now, and it never stops, and it limits what I'm learning to be a southpaw, because I'm doing more stuff with my left hand and my left arm than with my right. But there are some things you just can't do with only one arm. If you're not used to using only one arm, like some people have prosthetic arms or no arm, but there are some things I can't do without using both arms, and it hurts. Matter of fact, just before I started this video, I was doing something, and all of a sudden I got a sharp surge of pain. It must have been at least an 8, and I had to stop and let my arm hang down and just stop for a few minutes and let the pain kind of come back down to a 7 or a 6. So, as far as I'm concerned, healthcare from the VA is just shit. It's just not what it used to be. And the fact that they're letting this veteran suffer with this pain, refusing to help me with the pain, even though I told them that codeine and Tylenol brought the pain down to a dull ache. It never affected my mind. It never made me dizzy or foggy brain. It did nothing except work on this pain. And I can live with the dull ache. It's a sharp pain I can't deal with, man. It's just, it really hurts. It really hurts. And so the VA just refuses. They let the veteran suffer, and they send bullshit like lidocaine patches that don't do a damn bit of good whatsoever. So I'm really pissed off at the Veterans Administration. I think it used to be a good place to get medical care. Now it's just bullshit. It's just, it sucks. VA healthcare sucks. And that's all I can think about saying right now. Probably when I finish this video, I'll remember, oh, I should have said this or I should have said that. I don't know. But for you veterans who want to use VA healthcare, I suggest you try getting additional besides VA healthcare. Like, for those of you who aren't 65 yet, you can't get Medicare, but there's TRICARE, there's something else I think called CHAMPS or something. Have a backup plan, because if what you get from the VA is bullshit medical service, you need to have a backup plan somewhere. So I'm only going to use the VA for things I absolutely have to. Like, I had a mini stroke at TIA back in '99, and now I'm on warfarin, and they check my INR once a month. So I'll continue doing that. And my Medicare PCP, primary care physician, the best doctor I've ever had in my life. I really like him a lot. He's a really good man. I trust him, and I'll continue seeing him. But anything else that I try to get from the VA, like infectious disease control or like pain medication for my shoulder, they can go screw themselves. I have no respect for the VA anymore. I think it used to be good, but now it's just bullshit. So I wanted to share that with y'all, and I'm going to make another video. I made a video some months ago about going to ghost towns in Texas, and I said I would give you an update on how that worked. Well, I haven't had a chance to do that yet, but I'm going to make another video probably after this one, a little time after this one, explaining about my trip with my friend to visit ghost towns in Texas. But as far as this VA healthcare goes, I think the VA sucks. It really sucks.